Smokers and people who previously smoked need to keep in mind new lung cancer screening recommendations. The American Cancer Society issued updated guidelines earlier this month, and it now calls for yearly lung cancer screening for current or past smokers, people who are age 50 to 80 with a 20-pack year history. That can be confusing, but a pack year history means smoking 1 pack of cigarettes per day for 1 year. November is Lung Cancer Awareness Month, and Dr. David Persse, Chief Medical Officer for the City of Houston, is joining us to go over these new recommendations. Good morning, Dr. Persse.
Hey, good morning. Thanks for having me.
Help us explain the guidelines, because it does get a little bit confusing with a pack year history and former smokers, and explain what this means.
Yeah, so as you explained, a pack year history is smoking 1 pack a day for a year. That's a term that doctors are very familiar with, but most people in the public are not. And so this is for your persistent smoker, really. And they did change the guidelines. They've expanded them. So as you pointed out, it used to be for adults aged 55 to 74. They've now expanded that so that it's now for people between the ages of 50 and 80. It also used to be if you had quit smoking less than 15 years ago. Now they say it doesn't matter how long ago you quit smoking. And in addition, they looked at a 30-year pack history of smoking, and now that's been reduced to 20. So they've really expanded the number of folks who should consider getting screened for lung cancer. And that's because the earlier you catch lung cancer, the more easy it is to be cured. And that's really what we want. We want to stop the cancer, get rid of the cancer, completely cure the person.
You know, Dr. Persse, though, there's people who are listening who are going to be like, well, I haven't smoked since the 90s. And so they think that, because of previous guidelines that they're in the clear. But these new guidelines are saying, no, you're not.
Yeah, that's right. And it used to be believed that the number of years since you had your last cigarette, that your risk went back down to normal. What we now know is that's not necessarily true, that, as we get older, our risk of developing cancer, whether you were a smoker or not, actually, as we get older, anybody can get cancer, can get lung cancer. Smokers are a much, much greater risk. And it used to be believed that, the longer it was since your last cigarette, you went back down to sort of the normal risk. And now we know that's not necessarily the case. So if you were ever a smoker, and now that you're over the age of 50, you really need to get screened.
And is that because you're finding that the people who haven't smoked in that long are still at risk for getting cancer and dying from this cancer?
Yeah, absolutely. So unfortunately, your risk of lung cancer from smoking, it never goes away. We used to believe that it went back down towards the normal level, which is not zero, but that's not the case. What we've learned over the years is that if you were ever a smoker, you have a risk for cancer, lung cancer, for the remainder of your life. And so this is why they've expanded the screening. Again, a lung cancer that's caught early can be cured. We can get rid of it, and you won't have to worry about it anymore. Unfortunately, if you wait until you develop symptoms, that's when it's probably spread, and it's going to be much more difficult to get rid of. And a lot of people get lung cancer. So we estimate that, in this coming year, almost 250,000 Americans will be diagnosed with lung cancer. And unfortunately, about half of those are going to die from the disease.
Yeah, so for Dr. Persse, for people who are former smokers who are getting their regular checkups with their doctors, what type of screening detects lung cancer?
Yeah, so that's one of the great things about it. It's called low-dose CT, computerized tomography. So it's a CT scan. It's low radiation dose. They become very, very good at this now, so the dose is really low. But all you have to do is you get an appointment, you go to the CT radiology place, and you just lay down, and the machine goes over you. There's no needles, there's no pain, you just have to lay down for a couple minutes, let the CT do its job, and then they can detect really, really small cancers when they're really, really early and curable. And that's the word. They're curable if we can catch them early enough.
All right, good information.
Would that take a lot of talk with a doctor, though? Is that test hard to get?
So it's not hard to get. I mean, it does require a physician's, order to get it done. And, everybody's situation is a little bit different. And so you really do want to talk to your doctor about the pros and cons of it. It's very low on the cons, but, perhaps if you're, really young, or you've got other complicating factors, the doctor may think that there's a different way to screen you. But for 90+% of us, it's going to be the low-dose CT scan, and it does require your doctors, to write the order for it. And so, yeah, talk with your doctor, see if you require, or see if you're eligible for it, see if it's a good idea for you. And if it is, then I would go get it. Absolutely, I would go get it, because catching the cancer early so that you can get rid of it is far better than having to fight cancer year after year after year, and then in the end may lose that battle.
Yeah.
Yeah, I think you're right. Dr. David Persse with the City of Houston, we appreciate you joining us this morning.